back to your point, you know, regulating peanuts. The talk we had this morning. I don't know whether Matthew is still around. Doesn't look like. But the point there is, how do you want to approach it? Regulating crisps, would that work by saying, okay, you know, I'm just making something up. You can only sell it from 8 o'clock in the morning until 8:15.
Small sizes or something. I don't know. I mean, I know that my body shape changed massively when I sort of like had a big spate of buying. Well, it's not a mystery, you know.
No. But the question is, how do you want to tackle it? How do you want to solve it?
More investment in public health, more investment in education.
I think the obvious way forward is thinking about education and thinking about building up alternatives. Crisps are unfortunately rather sexy.
Crisps are brilliant.
Yeah.
Best medicine.
Anne, sorry.
I think the point you were making earlier about economics is extremely important, and I think if I understood you correctly, this was the point you were making as well. I'm hopeless at remembering figures, so I can't quote them. But the value of the food industry to UK PLC is very high. And the same sorts of arguments get presented as they do with biotech and the pharmaceutical industry, the value of that to UK PLC, which is, you've got to make sure that that you don't lose. This is particularly actually this is a more domestic version of it. That you don't, if you try and do something which is going adversely to affect the food industry, you're going to get MPs jumping up and down saying, you're closing all the factories in my constituency and I'm going to be represented. So there's those kinds of factors. There is also, you have to look at whether it's New Labour or the current kind of government, that the ideology is people need to be free to make their own choice. There is a limit to which the government or the state has a legitimate role, so the argument goes, in telling people what they should eat. I mean, an area which is particularly ferocious and particularly long-standing is with school meals. How far should the state have a role in telling parents how to feed their children, and how far is that an unwarranted intrusion? And that school meal version has been going for 100 years. But when you suggested, it's a public health matter and education matter, that is consonant with an ideology that, yes, people should be free to choose. They should be free to choose, and the supermarket should not be regulated so they limit the size of crisps, or they don't have, they don't have loss leaders, which are high in salt and high in fat and low in fibre and so on. The argument then being that goes with it is twofold. It then says we have to educate people, because if people are going to make a choice, we have to assure that they are making an informed choice. So we have these campaigns that tell people that they ought to eat 5 a day or that things reduce salt. And that then, so that's one arm of it. And the other arm of it, of course, is labelling. If people are going to be able to have this informed choice, and that they are going to be free to make the choice, they have to know what's in it. So labelling is a particularly politically sensitive and contested field between the industry and the regulators. And you can look back and you'll find quite a lot of the history of it on the FSA website over the last sort of 6-7 years, particularly with whether or not you're going to have the sort of traffic lights that Sainsbury's have, but Tesco doesn't have. So the regulatory questions arise in the context of the value of the industry, as well as the nature of the governing party's ideologies about how people feed themselves, and whether or not this is a matter of individual choice to which people have to be free.
I also think...
Speak up.
I also think
Please.
That there ought to be somehow investment in communities and community knowledge.
Well, what does that mean? What is
I guess
community?
community means investment in public spaces and people down and different together. Not music, but in localities and communities within communities, etc.
There is.
Well, yes, I know it exists, but I think more.
I suspect there's two things, and I don't know the small literature, I'm tell you what. The kinds of projects like Sandro, about which I know a smidgen.
Anne, could you speak up so that the conversation is shared amongst the heroic folk who've stayed?
Because I'm worried about prolonging it.
No, carry on. You've got a while yet.
The kind of projects where you go into one of these estates where there are either no shops or there are small corner shops with very high cost food and very poor quality and not many vegetables because it's just not economic. So they start cooking schools or groups for women who are stuck on these estates. And the problem is that these tend to rely on two things, since that's the classic feature of many health promotion activities. One is that it tends to rely on a particular person who is particularly charismatic or particularly committed. And when that person has had enough, then health collapses. Or alternatively, it relies on applying for things like lottery funding, and the funding is very fragile. So the minute you get a new government, or the minute the initiative is, we've put money in, we've talked about it in Parliament, we've done a 2-year thing, look, that's going wonderfully. End of 2 years, these things collapse. Because I think the very understanding of community is a problem. Because it implies that there is something there that is alive, that has a life of its own, that's homogeneous. And I don't believe any of those. And I think that's a problem. Community is a very useful word because it can mean all kinds of things that may or may not have an empirical reference, but everybody who's talking about it can believe it's a frightfully good thing. So I regret to say I'm mentally sort of cynical about it.
Well, I disagree with you actually, because why does the funding for community development projects disappear while the funding for acute surgery or acute neonatal intensive care doesn't? Why is it? And if you go to a PCT and say, okay, we've got 40% cuts across the board here, what are you cutting? They're not cutting the core acute services, even at the top end of the cost per quality side. They're cutting the bottom end stuff and the health promotion stuff and the healthy place stuff. And the reason they're cutting it is because they could put their hands up and say, we don't have any evidence that this works. And when you actually ask yourself why they don't have the evidence that it's worked, it's because they haven't spent the amount of money necessary to generate the evidence. So you're in a catch-22 situation. You don't get the investment. Nobody's spent £500 million on research into prevention in the UK, probably over the last 50 years. And that's one pharmaceutical to market. So,
I'm not disagreeing with you at all. I entirely agree with you.
So,
I wrote about it something like 30 years ago.
so how many economists do we have here? None. So I think there's a general plea that as this discussion goes and debate goes forward, as well as having the sociological and the historical and the anthropological angle on these things, actually, if we're seriously interested in this area, that some sensible, a sort of economic analysis of the whole field and the evidence around it and the way the things work might be useful. It's certainly something we're trying to drive in the prevention. Sorry?
Who's going to fund that analysis?
I was hoping you would, Anne. We're on whichever committee you chair at the moment. Okay, well, everybody was really keen to draw it to a close, and I think we had an interesting discussion. I'm sorry I went on with my presentation a bit long, but I hope that we'll be able to pick up some of these issues as the programme moves forward over the next few days. So thank you very much to the panel for their contributions, and see you all tomorrow.
We'll be here tomorrow.
Huh?
We're here tomorrow.